Greetings, dear colleagues and dear listeners. My name is Ilona Sidarovna. I am a student of the dental faculty of Ural State Medical University. I would like to present to your attention the article The Effects of Drugs on the Conditions of Oral Cavity in Cardiovascular Disease. Cardiovascular disease are a common problem in the world. According to clinic guidelines, the mortality rate in the world has researched about 80 million people. In the treatment, various medications are used to cause and disable reaction of the oral cavity. The purpose of the study is to analyze the effect of medicines on the state of the oral cavity in cardiovascular disease. The article included systematic reviews of available scientific publications obtained as a result of research of the Electronic Library, eLibrary, and PubMed by keywords drug effect oral cavity for the last 7 years. Histamine is a common side reaction that occurs after the use of drugs in the treatment of a heart disease. In a study conducted in India, histamine was detected in those who took a combination of drugs, beta blockers and angiotensin converting enzyme inhibitors 11%, beta blockers and diuretics 90%, monotherapy with calcium channel blockers 90%, only AC inhibitors 12%. A decrease in saliva secretion is associated with a decrease in the activity of salivary glands. This undesirable reaction is thus dependent. It turned out that older people have tendency to hyposalivation. Older people over 65 years of age were 3 times more likely to complain of histamine. With arterial hypertension, they took diuretics that reduce the rate of salivation. Histamine causes various complications. One of them is candidiasis. The cause of histamine may be dehydration of the body, increased water excretions called for by diuretics. In particular, the loop diuretics furosemide. Allergic reaction when used antihypertensive drugs manifest themselves in the form of angioedema in the elderly and children. The next reaction is hyperplasia of parotid artery when using antihypertensive drugs. In the examination of 180 patients, to 32% high bilateral enlargement of the salivary glands. On the study, agasia dysglasia manifested by painful edema was observed in 20% of patients due to admissions. In Japan, FAVs also were found in patients with angina pectoris and atrial fibrillations. Also, they accompanied by pain. After discontinuation of a course of treatment in 2 to 3 weeks, the disappearance of ulcer was noted. Also, when using IC inhibitors, pemicoid-like and lichenoid lesions are detected. In a study conducted in Saudi Arabia, 50% of 500 and 51 patients were diagnosed with Wilson lichen. The both manifestations disappear after the withdrawal of medications. Cardiovascular disease is widespread in Russia today. When taking medications in the oral cavity, adverse reactions are observed, such as dryness and burning, and change in taste and the appearance of various changes. The dentist needs to conduct a thorough collections of anamnesis for the diagnosis of disease. On this slide, you can see the list of reference. Thank you for your attention.